There are two reasons why we do not trust the people. Number one, we know them. Number two, we do not know them. So, to whom we know, we should never trust, but whom you do not know, we have some suspicion about them that they can be dangerous for you. Now, the types of the albinism classification is based how they are inherited and the gene that is affected. Usually divide for the convenience into three major types, and the different books do divide into seven groups. But I have made it convenient for the students that it is better to have three types. Sorry. Number one is oculocutaneous albinism, which is abbreviated as OCA. The other is ocular albinism, and the third is albinism related to the rare hereditary syndromes. So the first, the oculocutaneous albinism, which is abbreviated as OCA, it is the most common type. Person inherited two copies of the mutated gene, one from the father, one from the mother, one from each parent. So that is autosomal recessive inheritance, as I have already shown you in my previous slides. It is result of a mutation in one of the seven genes from OCA1 to OCA7. Now, oculocutaneous albinism, OCA, a type of genetic mutations which prevent complete synthesis of the eumelanin or the pheomelanin, the part of the melanin in total. So decreased or the variable pigment in skin, hair and the eyes is seen. The density of the melanocytes in the skin is normal, but the ability to produce pigment is absent or decreased. 90% patients have mutation in the gene that encode either tyrosinase, the precursor that is called type 1, or P protein production, that is the type 2 type 2 defects. Oculocutaneous albinism are mainly of the four types. These are oculocutaneous albinism 1, oculocutaneous albinism 2, oculocutaneous albinism 3, and oculocutaneous albinism 4. So these are just abbreviated as OCA1, OCA2, OCA3, and OCA4. So the first we are going to discuss OCA1, oculocutaneous albinism, a tyrosinase related albinism due to the genetic defect in the enzyme tyrosinase that changes amino acid tyrosine to the pigment melanin. So the tyrosine is very essential or the precursor of melanin. There are two types of the OCA1, that is called OCAA and OCAB. So the OCA1 type A, here the enzyme is inactive and the no melanin is produced, leading to the white hair and white light skin. In the type OCA1B, the other subtype, here the enzyme is minimally active, some melanin is produced, so the hair are darkened to blonde, yellow or the orange or even light brown because of the some melanin, whether pheo or the other melanin is present. There is slight more pigment in the skin and they are not totally white because of the presence of some melanin, pheomelanin or the other type of melanin. Now, this is OCA1. They people have the white hair, very pale skin and the light colored irises, as one can appreciate here. The other type is oculocutaneous albinism, OCA2. It is a P gene albinism resulting from the genetic defect in P protein that helps tyrosine enzyme to function properly so that this enzyme can convert properly the tyrosine to the melanin. Here, tyrosinase functions normally tyrosinase positive albinism, but P gene, a tyrosinase, a tyrosine transporter is defective. The enzyme is proper, but the transporter of the enzyme is defective. These patients make a minimum amount of melanin and can have hair color ranging from very light blonde to the brown. Hair, child skin and eyes begin to darken with age. So here one can see OCA2, minimal amount of the melanin pigment. It is less severe disease and the skin creamy white color and the hair may be light yellow blonde and the light brown, as one can see the hair of these and their skin is also, one can see that having no pigment and the hairs and the other part are having some melanin, so that is the OCA2. Now, OCA3, oculocutaneous albinism, it is rare and result from the genetic defect in TYRP1, a protein related to the enzyme tyrosinase functioning. I have told you that tyrosine have to change into the melanin by the different steps, by the different protein, the different transport mechanism, and the different genes which are responsible for the normal functioning of the tyrosine to become melanin. So here in this OCA3 type, there is genetic defect in TYRPA1, a protein related to the enzyme tyrosinase functioning. These patients have substantial pigment. It is also known as brown OCA with minimal to the light brown skin pigmentation. TYRP1 means tyrosinase related protein 1. It is encoded by TYRP1 gene associated with the melanogenesis and the pigmentation disorders of the skin. Besides its enzymatic activity, it has a structural role in melanosome. So all these lead to the defect in the pigment melanosomes and the enzyme conversion from the tyrosine to the melanin. Melanocytes of the normal skin express TYRP1. Sensitivity and the specificity of the TYRP1 is used for the diagnosis of the melanoma also. So here one can see the OCA type 3 usually affects dark skinned people, reddish brown skin, ginger or red hair, hazel or the brown irises. So these are the characteristic of OCA1 3 type of albinism. Now, OCA type 4 albinism, it results from the genetic defect in SLC45A2 protein that helps tyrosinase enzyme to function properly. These patients make minimal amount of the melanin similar to the patients of the OCA2 type. So one can see OCA4 type, similar symptom to OCA2 type, light skin, yellow blonde or the light brown hair, occurs frequently in the Japanese and the Korean production. And again, I have told you there is some defect in the manufacturing of the melanin, starting from the tyrosine to the melanin by the different activities of the enzymes and the different proteins and the different genes which take part the proper and the normal production of the melanin from the tyrosine enzyme, amino acids. Now, the other type, besides oculocutaneous type, is the ocular albinism. It is mainly limited to the eyes, so the name is ocular albinism, causing VN problem, not skin or the hairs are involved. There is no coloring in the retina. The most common form is the type 1, inherited by the gene mutation on the X chromosome. X-linked ocular albinism is passed on by a mother who carries one mutated X gene to her son. So this is X-linked recessive inheritance. It occurs only in the males and it is less common than oculocutaneous albinism. And here one can see the ocular albinism, the retina, the iris without pigment and looks pink and red, and that is not enough pigment in the eyes. I do not took in the some direction, reduced VN and issues with the optic nerve. So sensitivity to the bright light is there and the patient does not have the proper VN and have to have the help by the different gadgets to restore the view. Now the third type is albinism related to the rare hereditary syndrome which also present with the albinism. These are number 1, Hermansky-Pudlak syndrome seen in the Puerto Rico population. It involves the nose bleeding also. There is the bruising, lung and the intestinal disorder which have been seen in this syndrome. The other syndrome is Shediac-Higashi syndrome. It includes the immune problems with recurrent infections, neurological abnormalities, finally defect in the melanosome production which result in the entities like Hermansky-Pudlak and Shediac-Higashi syndrome. The next is Gris-Celli syndrome, and here one can see the Hermansky-Pudlak syndrome, the hair color and the skin color and the eyes color. These are having some defect somewhere in the hair, in the eyes or the skin color. Then Shediac-Higashi syndrome, here one can see the color of the hair and the color of the eyes and the skin that is present in this syndrome. So a good child and the brilliant child who can rise in the world do take the heart of the mother and the brain of the father. By combining these two things, the resultant kid can flourish and become a great kid. Now, the diagnosis of the albinism, it is based on physical examination to check skin and the hair pigmentation. A thorough eye examination includes an assessment of the potential nystagmus, strabismus, photophobia, and inspect the retina of the patient also. Medical history including whether any bleeding disorder, bruising, or unexpected infection to rule out the possibility of involvement of any other rare syndrome. Genetic tests like chorionic villus sampling test CVS during the pregnancy and amniocentesis during the second half of the pregnancy can reveal the problem of the albinism may be there in the coming future kid. Now the differential diagnosis is from the vitiligo, absence of the melanocyte histologically, and the inborn error of the metabolism as one can see in the phenylketonuria and the aniridia. These are the diseases which are having the same presentation. Now coming to the treatment, albinism is a genetic disorder. There is no cure for that. Treatment include only to reduce the symptom, proper eye care and the proper skin care is mandatory by ophthalmologist and the dermatologist. Eye care include annual examination, wearing prescription corrective glasses, rarely surgery on the optic muscle to minimize nystagmus and to correct the strabismus also. Skin care and the prevention of the skin cancer in these kind of the patient is very much there. So protect the skin properly. Now, the annual skin assessment to screen for the skin cancer An aggressive skin cancer melanoma can appear as pink skin lesions. Photoprotection and the sun avoidance is mandatory. Patients are prone to severe actinic damage, so monitor for development of the actinic keratosis, basal cell carcinoma, squamous cell carcinomas, and the melanomas. These are the most rare in these patients who produce least pigment and those who are albinos. So the lifestyle and home remedies use low vision aids like hand-held magnifying glass, a, mon, a, a monocular or a magnifier attaches to your glasses, a tablet synchronized to a smart board, an alternative electronic board with a touch screen in case of the classroom you are attending. Always use sunscreen with a sun protection factor SPF of 30 or greater to protect against both ultraviolet A and ultraviolet B light of sun. Protects eyes wearing dark ultraviolet blocking sunglasses or transition glasses, photochromic glasses, lenses that darken in the bright light and just in the dark light they become more brighter for the proper vision of the person who is having albinism. Strictly avoid high risk or the prolonged sun exposure, like being outside for the long periods in midday at the high altitude, sunny days with thin colored cover, wear the protective clothing, colored clothes, long sleeve, collared shirts, long pants, and the socks to avoid the sunburn and the extraordinary sun exposure, broad brim hats, and special ultraviolet protection clothing and creams are. So the prevention is by the counseling, genetic consultation for the future child, and the test during the pregnancy to see the possibility of albinism in the coming kid. So that is the end of the lecture of the albinism. I hope you may like this lecture. If you like this lecture, please subscribe my channel and just share it with the other for the information. I have tried to give the maximum information as much as possible to make the lecture as easy as possible. So please just see and just subscribe my channel. And if any question, you can ask me on my numbers which are given. And thank you very much to be with me